Good day, I am Joy-Ann El Mahaba, your student nurse, and today I will perform essential newborn care. For the procedure, preparing for delivery, first check the temperature in the delivery room area to be 25 to 28 degrees Celsius and eliminate air drop. Then ask woman if she is comfortable in the semi-upright position. So ma'am, are you comfortable with your position? Okay. The semi-upright position and the dorsal lithotomy position is the default position for delivery. Ensure the woman's privacy. Remove all jewelry, then wash hand thoroughly, observing the WHO 1, 2, 3, 4, 5 procedure. Then prepare a clear, clean newborn resuscitation area on a firm and flat surface. Then check the equipment if clean, functional, and within easy reach. Then arrange the materials or supplies in a linear sequence. So we have here the gloves, the dry linen, bonnet, the oxytocin injection, plastic clamp, the instrument clamp, and the two kidney basin. In a separate sequence after the first breastfeed, we have the eye ointment and the stethoscope for the physical examination. We also have here the vitamin K, the hepatitis B, and the BCG vaccine, plus the cotton balls and many more. Then clean the perineum with antiseptic solution. Then wash hands and put on 2 pairs of sterile gloves aseptically if same worker handled perineum and cord. At the time of delivery, encourage woman to push as desired. So mom, this is what are you going to do? Inhale, exhale, then push. Inhale, exhale, then push. Push as hard as you can. Then next is drape clean, dry linen over the mother's abdomen or arms in the preparation for drying the baby. Then applied perineal support and did control delivery of the head. Baby boy out 7:45 a.m. Then thorough dry the baby within 30 seconds, starting from the face and the head down to the trunk and the extremities, while performing a quick check for breathing. Then remove the wet cloth. Then place baby skin-to-skin contact on the mother's abdomen or chest. This promotes mother and child bond and breastfeeding success, lymphoid tissue system stimulation, exposure to maternal flora, protection for hypoglycemia, and thermoregulation. Then cover the baby with a dry cloth and the baby's head with a bonnet. Then exclude second baby by palpating the abdomen in preparation for giving oxytocin. Then give IM oxytocin with 1 minute of baby's birth. This will prevent hemorrhage or excessive bleeding after the vaginal birth, after wiping the soiled gloves with the wet cloth. Then remove the first set of gloves after positioning the baby for cord clamping. Then decontaminated the gloves properly in a 0.5% chlorine solution for at least 10 minutes. Then palpate the umbilical cord to check for pulsations. After pulsation stop, clamp the cord using the plastic clamp 2 cm from the base. Then place the instrument clamp 5 cm from the base. Cut near plastic clamp, not midway. Perform the remaining steps of the AMTSL. First, remember that need to cover the baby. Waited for strong uterine contraction, then applied controlled cord traction and counter traction on the uterus, continuing until placenta was delivered. Massage the uterus until it was firm. Inspect the lower vagina and perineum for laceration or tears as necessary. Examine the placenta for completeness and abnormalities. The placenta is complete and has no abnormalities. Clean the mother, flush perineum and apply perineal pad or napkin or cloth. Check the baby's color and breathing. The baby's color and breathing are normal. Check the mother if she is comfortable and uterus contracted. Mom, are you okay? Dispose the placenta in a leak-proof container or plastic bag. Decontaminate, soak it in a 0.5 chlorine solution instrument before cleaning, then decontaminated second pair of gloves before disposal, stating that the contamination lasts for at least 10 minutes. Advise mother to observe for feeding cues and cited example of feeding cues. So mom, maintain skin-to-skin contact with your baby. Then the feeding cues such as sucking, licking, mouthing, and rooting. Then after that, support mother, instruct her on positioning and attachment. Then wait for the full breastfeed to be completed. After a complete breastfeed, administer eye ointment to protect from an unknown gonorrhea infection in the mother's body. Next is thorough physical examination to confirm normality and identify any congenital abnormalities and exclude medical concern. Then administer vitamin K to prevent low levels of vitamin K and vitamin K deficiency bleeding. Next is hepatitis B to protect the baby as early as possible from any exposure to the hepatitis B virus. And BCG to protect the baby from serious form of tuberculosis such as meningitis and miliary tuberculosis. Advise optimal or delay bathing of baby. So mom, it is advisable to delay bathing of the baby because delayed bathing provides more initial skin-to-skin contact between you and your baby. And early washing things curling reflex, it can also lead to hypothermia. Advise breastfeeding per demand. In the first hour, check the baby's breathing and color and check the mother's vital signs and massage uterus every 15 minutes. In the second hour, check mother-baby diet every 30 minutes to 1 hour. Then, lastly, complete all records.